Welcome to the Super Healthy Human Podcast with Dr. Rodger Murphree.
After specializing in fibromyalgia for 2.5 decades, working with patients all over the world, when I encounter a new patient, the first thing I look at is what can I do to help them feel better as quick as possible. And there's certain common denominators, help them get a good night's sleep on a consistent basis, help them with getting more energy by fixing low thyroid issues or adrenal fatigue. But one thing I look at right away in the new patient paperwork is what prescription medications are they taking? Everybody's fibromyalgia is a little bit different. There's different triggers that create the symptoms of fibromyalgia, although they're common symptoms, of course, but everybody's fibromyalgia is a little bit different. And working with complicated patients, I want to see what is it I can do right away that's going to make a difference. So one of the things that I find with so many of my patients is that their doctors don't really understand fibromyalgia. They're not bad people. They just don't understand fibromyalgia. And the tools that they have, which are prescription medications, don't work, at least not long term. Short term, yeah, they can be helpful, but long term, they create more problems. To give you, for instance, so you might be an individual, or you maybe been recommended taking Lyrica or Neurontin or one of these other medications, anti-seizure medications that have been approved by the FDA for fibromyalgia. But what you may not realize is that those medications in particular can create a domino effect that then causes you to get on more and more medications. Case in point, it's not unusual to see a patient start on Lyrica and start to gain weight. Typically, some patients gain 10 pounds a month. Their blood sugar starts to go up, so now their doctor gets concerned, puts them on blood sugar medication like metformin or maybe insulin if it's really bad. Oftentimes, because they've gained this weight, they're retaining fluid, so you start seeing swelling in your ankles and feet. So the doctor may put them on a diuretic to make sure they don't develop high blood pressure or to get some of the swelling down. The diuretic then can create problems with electrolyte deficiencies, low potassium. So now you start developing muscle cramps or restless-leg syndrome in the middle of the night. So now they recommend something, like Requiem or something to help you with the restless-leg issues that you have. And this is this domino effect that I see. Before you know it, this person that went into their practitioner and said, I've got all these symptoms, and he or she said, well, your blood work looks fine because they're doing basic blood work. And they put them on something like Lyrica. Hey, this is what is FDA approved. This is what we think, can be helpful. Let's put you on that for 6 months and see how you do. And then when they come back every month, because they're typically only about 30% respond to Lyrica, they come back sharing that, hey, I'm really not any better. The doctor wants to be helpful, so he or she recommends something else. The more you throw into this pot of soup here, and that's really what it is. Let's just throw something in here and see if we can get it to work. And it's so frustrating being a practitioner who specializes in fibromyalgia, because I see how frustrated you who have fibromyalgia have been kind of led to believe that we're going to find this mixture of prescription drugs that is going to really allow you to be able to get your life back. And it just unfortunately doesn't work that way. Owning a large medical practice for a number of years here in Birmingham, Alabama, with 5 medical doctors working for me, we tried all the different medications. We very judicious use of the medications, prescription drugs. But more and more we steered towards natural approaches 20-something years ago, because we found that drug therapy alone is a dead end for fibromyalgia. For one reason, most people with fibromyalgia are not only super complicated, they have a lot of different symptoms being driven by a bunch of different conditions. And that can be a problem with your thyroid. It can be a problem with adrenal fatigue. It could be sensitivity to mold. It could be Lyme disease and not properly diagnosed. It could be heavy metals. It could be yeast overgrowth, leaky gut, food allergies. And oftentimes it's all of those things. And that's why no one can figure you out. But if you don't really become educated, knowledgeable about what prescriptions you're taking, you run the risk that the medicines you're taking are actually causing you to become worse and worse month after month, year after year. Now, I'm not saying stop your prescription drugs. Don't do that. You can't do that. But what you want to do is work with your practitioner, or even better, find a functional medicine practitioner like myself can help you sift through all this and navigate it in a way that if this medication is not helping you, why should you take it? And of course, that's a silly question, right? But for so many people with fibromyalgia, because they're so complicated, they're taking drugs that their doctors recommend because they're hopeful. they need to do something. They're miserable. So I get it. And we've all grown up, certainly I did at my age, that, we listen to what our doctor says and we try it. But most of the time, not always, but most of the times, doctors don't spend the time sharing with you the potential side effects of the drugs they recommend. They're just trying to be helpful. That's their job. And they're trying to do the best that they can. But again, most practitioners, unless they are in functional medicine or integrated medicine, whatever you would call it, where they're knowledgeable about alternative therapies, things that are more natural, they're going to rely on a book. Here's the diagnosis. Here's the playbook. This is how we do it. And they're not going to deviate from that. Now, there'll be certain people that are going to be fine with that. They're going to respond. They're going to get better, whether it's on Lyrica or Savella, Cymbalta. They're going to take Ambien to help with their sleep, whatever it is, and they're going to be fine with that. But there's the majority of the people are going to go down that road and they're going to be frustrated because they don't feel better and eventually they feel worse. And that's what really robs people with fibromyalgia. It's not so much that this condition is something that is a chronological, here it is, and you're going to keep getting worse. It's the fact that the longer you have it, the more complicated it is oftentimes to get rid of it because you develop other symptoms from becoming so sedentary, from not getting enough sleep, from taking prescription drugs, creating other side effects. I can't tell you the number of patients that I go back and I look at their history and I'll ask them, when was the last time you felt good, Jane? And Jane will say, well, it's been 20 years. And I say, well, God, 20 years ago, what was going on? Usually there's some type of stressor, some type of trauma, some type of an event that's going on. It could be something that had been going on for quite some time, or it could be something that was just immediate stressor, like the death of a loved one, or maybe they lose the special needs child, or whatever it is. They've been under a lot of stress, but something comes along that's the straw that breaks the camel's back, and that's it. But a lot of times, what I'll also find out is 20 years ago, or 10 years ago, 5 years ago, is when they started having some issues with poor sleep. And their doctor put them on a medication to help with sleep. If they put them on something like Ambien, and yes, started helping with sleep, but then they started developing diffuse achy pain or brain fog or irritable bowel symptoms, which are all associated with Ambien. And then the doctor puts them on another drug, and then but to help with what's going on. That's not unusual. Or they put them on an antidepressant, and the antidepressant ironically can cause people to be more depressed and actually can cause them to feel anxious. It also can create diffuse achy pain, brain fog, and poor sleep. Depending on which antidepressant, Paxil in particular can cause weight gain. And as these side effects build up, more and more drugs are recommended. Statin medications. None of my patients' problems that eventually turned into fibromyalgia started off because they went to their doctor and their doctor was well-meaning, but told them, hey, you have elevated cholesterol. Let's put you on a statin medication, lipid, cholesterol lower medication, and try to get those numbers down. What they're not telling that individual is that the first year alone, 13% of those individuals who take a statin drug are going to develop symptoms very similar to fibromyalgia: diffuse achy pain, brain fog, weight gain, fatigue, exertional malaise, where little things that you used to be able to do, walking up a flight of steps, really takes it out of you. You become winded. It can create problems with mitochondrial efficiency, where the mitochondria are not communicating like they should. So now you might start getting neurological problems. Again, 13% of people who start a statin drug first year develop some type of neurological problem, where that's tingling in the hands and feet, burning in the hands and feet, cold hands and feet, problems of mental clarity issues, suicidal tendencies, anxiety, depression, and I can go on and on and on. Statin medications deplete your body of a crucial enzyme called CoQ10. CoQ10 is the spark plug of every cell. Without the optimal levels of CoQ10, your cells can't work like they're supposed to, and everything slows down and doesn't work like it's supposed to, including your nervous system. So that explains why you might start getting some nerve pain. Within the second year, up to 33% of people who take a statin drug will develop some type of neurological problem. The majority of patients, some 60%, cannot take a statin medication, at least the first one they're recommended, because they develop such pain in their muscle pain. CoQ10, again, is a big reason for that deficiency of CoQ10. But A lot of my patients, they get on these medications, they just start developing the symptoms. They don't realize it's from the medication. And then before you know it, a year goes by, 2 years goes by, they're just so run down. And something comes along, it's a stressor that, again, is the straw that breaks the camel's back, and now they can't sleep. And once you start to lose your ability to get consistent, deep, restorative sleep, where the body is repairing itself night after night, now it's a very slippery slope. Now you start to see a lot of other symptoms come on. You're not getting deep restorative sleep, you're going to have more inflammation. The studies show that you increase your inflammatory chemicals by 40%. Now that's quite a lot, but when you realize that most everybody you see, including yourself, including myself, we have inflammation that's going on anyway. Some of us have it under control, most of us do not. We may not have a diagnosis of inflammation associated with inflammation, although you may. It could be an autoimmune disease like rheumatoid, Reiter's, Sjogren's. It could be Hashimoto's disease. It could be cardiovascular disease. Inflammation is the driver of most every condition out there. Inflammation and stress. So everybody that you know, and again, including yourself, you're walking around with some form of inflammation. And if you increase that by 40%, you're already run down, you're already kind of running on empty, you're going to create some problems. Not only do you increase your inflammatory chemicals, but you sabotage your ability to get a good night's sleep going forward, because you get in this vicious cycle. As you become deficient in the hormones and chemicals that your body needs to help you get a good night's sleep, because you're under so much stress from not sleeping, it becomes a vicious cycle that you can't sleep the next night and the next night and the next night. That oftentimes leads to taking prescription sleep medications. And the sleep medications, not only do they increase your risk of death by 5-fold, no matter what condition it is, whether it's cardiovascular disease or cancer, but they also create additional side effects which translate into symptoms, whether it's brain fog, weight gain, fatigue, restless-leg syndrome, anxiety, depression, irritable bowel syndrome. The list becomes pretty long. And that's why when I'm working with a new patient, the first thing I look at is, okay, what prescription drugs are they taking? Do their doctors really know what they're doing? Is what they're taking helpful? A lot of times I see things like patients are taking a stimulating medication at bedtime. They're taking an antidepressant like Savella or Cymbalta or Effexor or Wellbutrin. Now, Cymbalta, Effexor, Savella, these are serotonin and norepinephrine reuptake inhibitors. So what they're designed to do is help your body to reuptake serotonin, which is very calming. So that's fine. That can help us sleep. But they're also designed to help you reuptake adrenaline, norepinephrine, which is stimulating. Now, there's a time and a place for that, but you certainly don't want your adrenaline being ramped up at bedtime, because that's going to raise your cortisol level and sabotage your sleep hormone, melatonin. But I see a lot of times patients are taking these SSNRIs, so a combination of serotonin uptake inhibitor, norepinephrine uptake inhibitors at bedtime. Once we move those two in the morning, then they do better. The sleep improves. I see people who are taking things like Wellbutrin, which helps to boost dopamine and norepinephrine. It's very stimulating, but that needs to be taken in the morning. Or maybe, like a lot of patients, they don't wake up till noon or 1 because they just can't sleep. They take that time-released Wellbutrin that's still in their system when they try to go to bed at midnight. And it's just, these little things add up. And that's why it's really important that you look at what are the prescription medications that I'm taking, or what are the prescription medications that are being recommended to me, and look to see, is this something I really want to do? Now, again, I'm not anti-drug. There's certainly a time and a place. But again, with fibromyalgia, it's such a complex condition that if we just try to drug our way out of it, we're going to create more problems usually. Not always. Again, there's a time and a place. Beta blockers, if you have high blood pressure, beta blockers can sabotage your energy. They can cause weight gain. They can cause fluid retention. So next thing you know, you're on a diuretic with the beta blocker. They're prescribed to help with mitral valve prolapse or AFib or cardiovascular conditions, including high blood pressure. And certainly, again, there's a place for them, but not long term. You want to look at, if you have high blood pressure, the first question is why? Is it because you're carrying around too much weight? That's oftentimes the case, not always. Is it because you're under too much anxiety? Is it because you're taking a prescription drug like an NSAID, non-steroidal anti-inflammatory, drug like ibuprofen, Aleve, or Mobic, these medications that can raise your blood pressure? Are you taking a stimulating medication like Adderall or Cytomel that can cause you to have high blood pressure? Or do you have hyperthyroidism? Your thyroid's overreacting. Do you have Hashimoto's thyroid, where the body is attacking the thyroid and you're going back between everything slows down, everything speeds up? Typically, underlying reasons, causes for your symptoms that we put a name on. But going back to beta blockers, one of the things I see with beta blockers, it just really zaps your energy. So when I have patients, they're telling me, I'm just really struggling, doc. I have no energy whatsoever. I'm seeing, I see their history and I'm looking at, okay, no energy, but what are you doing? So they're taking a beta blocker and they're taking Lyrica and some of these other things, or maybe they're taking an anti-anxiety drug like Klonopin or Valium or lorazepam, which are very sedating and relaxing. There's a time for that, but not long. I have patients that are taking anti-anxiety medication that can't get off of those medications. It's the worst nightmare you can imagine, because being on these anti-anxiety medications, lorazepam and Klonopin, Valium, doxepin, these medications, Restoril, they knock you out. They can make you feel really, they can calm everything down, and they can be helpful to get you to sleep if you're using for sleep. Obviously, that fibromyalgia. The problem is they don't put you into deep restorative sleep. So they knock you out, but you're not getting that restorative sleep that the body needs to repair itself. And without that, pretty soon, over a period of time, you can see that the body is start to have additional symptoms. And by the way, what is a symptom? A symptom is just a warning sign that something's not working right. It's no different than the oil light coming on in your car, or the brake light, you change your brakes, or the tire pressure light, whatever it is. It's telling you something's off that needs to be fixed. If you are struggling with some type of chronic symptom, the goal should be, okay, what is it that's creating that? Going back to high blood pressure. If you're carrying around 20, 30, 40 extra pounds, you need to realize for every pound of adipose tissue, for every pound of fat, your body has to pump blood through additional 10 miles of arteries, veins, and capillaries. That's a lot of work that's placed on the heart. So within a period of time, you're going to see that, yeah, your blood pressure is probably going to go up. If you're an individual who is under chronic stress and you're not dealing with that through cleaning up your diet, taking some time for yourself to, daily walks, exercise, if you can do that, meditation, prayer, whatever it is, you kind of find a release valve. But if you're under tremendous amount of stress and that's causing your blood pressure to go up, then you need to take steps to change your lifestyle. If you're taking a medication that may be causing elevated blood pressure, like in non-steroidal anti-inflammatories on a daily basis, you need to find a natural way to help with your inflammation and go even deeper. What is the cause of your inflammation? It's not a drug deficiency. Could it be a problem with food allergies? Could be. Could it be a problem with mold toxicity? Well, if you've been in a old house or a water damaged house, or lived through a hurricane and you move back into your house like some of my patients have, then yes, it could be the underlying cause of your inflammation is one of these things you've not really investigated. Most doctors don't think that way. Most doctors, and not to step on anybody's toes, I'm sure your doctor's wonderful, but most doctors don't look at you when you come in and think, what is causing their problem? They look at your symptoms, they put a name on it, and then they think about what is the drug I can give you to suppress the symptom. But just suppressing the symptoms doesn't correct the problem. Again, you want to be knowledgeable about the medications that you're taking. Recently, I had a patient that came to see me that had been taking non-steroidal anti-inflammatories for a number of years, taking anywhere from 800 to 2,400 milligrams of ibuprofen on a daily basis. Their doctor said, hey, listen, if you got pain, this is fine to do this. Well, they told them to do that 10 years ago. 10 years ago. Now they've had stomach issues, they've had all kind of problems. Nothing ever led them to go to the ER, which, by the way, NSAIDs create over 100,000 hospitalizations, and over 10,000 people die every year from chronic non-steroidal anti-inflammatory drug usage because it creates bleeding ulcers. This person never got diagnosed with a bleeding ulcer, but they had been on this medication for a number of years. And this is what I was able to go back and trace with them what started happening. Because of the NSAIDs that they had, they developed high blood pressure out of the blue. They weren't carrying around a lot of extra weight, but they were under stress. I mean, so that could have been a contributing factor. But they developed high blood pressure, and their doctor, tried to get it under control, put them on a calcium channel blocker. Calcium channel blockers increase your risk of death. But one of the things that can create a congestive heart failure. Again, not to scare you, just trying to educate you. But what the calcium channel blocker did, then it started to give them problems with electrolyte issues, and they started developing muscle cramps and issues where they had more and more pain. So then they put this individual on pain pills. It was temporary. We're going to put you on some pain pills, see how you do. Put them on Ultram or Tramadol. I can't remember which one it was. Sure, they did better. But then because they were on those medications, they started having constipation, bloating, gas, stomach pain, and eventually were diagnosed with irritable bowel syndrome. Because they had irritable bowel syndrome and couldn't use the bathroom, they were putting on lenses, and that medication caused them to have a perforated colon. So wound up in the hospital, developed pneumonia, and they've never been the same since. Now, that may sound far-fetched, but this is how this kind of stuff happens. Drugs can be incredibly helpful, but they can be incredibly dangerous. And so what I want to leave you with in this little short podcast is look at the medications you're taking. Yes, there's a time and a place. Is there natural alternatives? Oftentimes there is. Reach out to functional medicine practitioners. Check out my website, yourfibrodoctor.com, superhealthy.com. Check out the podcast, Super Healthy Human podcast. Do some research to see if any of the medications that you're on could be creating some of these symptoms that your doctors are telling you are all due to fibromyalgia. And that's another thing I want to bring up. A lot of times, you go to your doctor and you've got this diagnosis of fibromyalgia, and they treat you differently, by the way, right? When you get the diagnosis and you go, they just kind of give you the quick in and out. They tell you, oh, we're just going to talk about this today. And if you share something with them that you've got tingling in your hands and feet, they'll say, oh, that's your fibromyalgia. The tingling in the hands and feet could be from a medication like a statin drug, as I mentioned earlier. It could be a problem with your thyroid. Maybe your thyroid, which can become compromised when you get under a lot of stress. Can't think of anything more stressful than fibromyalgia and poor sleep and all the things you go through. But if they just tell you everything's due to fibromyalgia, your irritable bowels due to fibromyalgia, your migraine headaches are due to fibromyalgia, your fatigue's due to fibromyalgia. All they're doing is sweeping the symptoms underneath the rug, and they're just telling you, here, take this drug, here, take that drug. Again, it's not that they're bad people. They're not. They just don't understand fibromyalgia. And oftentimes they just don't have time to spend with you. They don't have time to spend with a complicated patient. They've got to see 30, 40 people, whatever it is a day, depending on what kind of practitioner you are. And if you go in with, which is typical, this is typical for my patients, with half a dozen to a dozen different symptoms, they're just going to look at you like, unfortunately, a lot of times like you're crazy. And you're not, but they're going to give you that impression, because how can you have all these symptoms and still be normal? Or how can you have all these symptoms and they've done blood work, typically just the basic blood work, and they tell you, oh yeah, everything looks just normal, right? You've been through that. I'm sure you've been through that. My patients have, for sure. And the only person that can help you is yourself. You've got to be proactive. You've got to know the medications you're taking, and hopefully you're doing the research to find out who can you get in touch with that can help you figure out what are the underlying causes of your symptoms associated with fibromyalgia, so you don't have to be on a lifelong path of one pill after the next, after the next, after the next, for the next 10, 15, 20, 30 years as you get worse and worse and worse and worse. Thanks for joining me. I look forward to sharing more information with you real soon.
Thanks for listening to Super Healthy Human with Dr. Rodger Murphree. Remember, your body is designed to heal. It just needs the right tools. Stay curious. Stay consistent. Stay super healthy. If this episode helped you, leave a review or share it with someone who's ready to take charge of their health. The information provided in this podcast is for educational purposes only and should not replace professional medical advice, diagnosis, or treatment. Always consult your physician before making changes to your health regimen. This content does not substitute medical care.